I'm Dr. Blanchard with Total Rehab, and today we are going to demonstrate a dry needling technique for the treatment of upper back pain. Dry needling is often used to treat trigger points, but can be used to treat headaches, neck pain, back pain, and any pain that's of a neuromusculoskeletal source. Dry needling uses acupuncture needles and often refers to acupuncture sites or points, but there are some fundamental differences between dry needling and acupuncture. One of the major differences is the depth of tissue that the needle is inserted in. So with dry needling, we actually go into muscles, we go around near nerve tissue, around joints, and sometimes even use a bony backdrop as the depth for that. Dry needling doesn't inject anything into the body like wet needling. We don't use cortisone injections, epidural, or PRP injections. It's just the insertion of the needle itself. So we have Emily here, and I have already marked out a few spots on her. The first line here is just along the spine. The second line is referred to as the HTJ line, and the second line is the bladder line. Those are just references for where to place the needles. So for the treatment of upper back pain, someone who has, let's say, primarily a right-sided upper back pain, will insert the needles according to the segments of the spine. So if we say here is about the first thoracic vertebrae, we would then insert the needle. In this case, we're going to come down to the second thoracic vertebrae and insert it just straight from posterior to anterior. Now we want to go down and target close to the facet joint. So we use a 50 millimeter needle, insert to that depth. I'm going to come back up a level to the first thoracic vertebrae, and here we're going to put it on an angle, a 45-degree angle, and again our target is the depth of the facet joint. There is oftentimes a little bit of discomfort on the initial insertion of the needle. Once it's in place, it's for the most part very comfortable. Again, sometimes a little bit of discomfort on the insertion. Once I get past that depth, it's usually fairly comfortable. Now we're just using an alternating pattern as we go down the length of the spine. Now there is a semi-standardized protocol for this technique, which also includes a needle on this opposite side, still on this first thoracic vertebrae. Now we target the opposite side facet joint. This next needle will go right on the spinous process between C7 and T1. And we just insert in a 45-degree angle downward. Now we could insert one up a little bit higher. I'm not going to do that for this demonstration. We're just going to show you one way that we can treat upper back pain is by hooking it up to electrical stimulation. So we would connect that needle, and maybe this one. And then with the other set of leads, we could connect this one, and then that one. Now we would turn this up to a intensity that's comfortable for the patient, and we would let that stimulate for about 15 or 20 minutes during that time. And that is the setup for upper back pain for dry needling.